Neglect. There is a lot of material about neglect on the internet and in textbooks, to the point that I have decided to only include within this video guide certain aspects of this pathological phenomenon that might be encountered in your family member who has suffered a stroke and is therefore suffering from left hemiplegia. This phenomenon, which is also known as hemispatial neglect, meaning the lack of awareness of one half, involves difficulty in paying attention to everything that happens on the left-hand side, including difficulty in paying attention visually, and as we will see, difficulty in paying attention to the left-hand side of the body itself. It mainly manifests itself during the first few weeks following the stroke, and you may become aware of it when you go to visit your family member at the clinic or the hospital, as they often tend to look towards the right and seem to have difficulty paying attention to the left-hand side if we speak to them from the left, almost as if they were to be distracted. Sometimes, in more serious cases, when the patient is eating and is seated in front of a dish, they will only eat the part of the meal that's on the right-hand side, and it is sometimes possible to simply turn the dish to make them continue eating. When shaving, for example, some patients only shave the right-hand part of their face and completely forget about shaving the left-hand side. In even more serious cases, the patient sometimes even forgets the armrest and will sometimes fall sideways from the wheelchair even without realizing what has happened. Some patients won't even acknowledge this as their own problem and will tell the nurse that the patient who occupied the bed before them forgot an armrest, but these are only the most serious cases. Whatever the case, this phenomenon can present itself in various degrees, from that which I have just told you about to only a slight difficulty in paying attention to information coming from the left-hand side. Is often mistaken for a simple visual impairment, although this is not the case. It's an attention problem, and we may therefore encounter instances with certain patients in which, in addition to motor difficulties, there are also these types of difficulties in paying attention to the left-hand side of the body. The exercises have therefore been structured to focus upon the patient's attention as a primary element, and this is essential in order to allow the patient to gain a better awareness of their left-hand side. For this reason, the exercises that I will be explaining to you later place a great deal of attention upon this aspect and will concentrate upon improving the patient's perception of the left-hand side of their body. The barrage test. This is a rather simple test to perform at home. In order to evaluate and quantify the difficulties the patient has in exploring the left visual field. In order to perform this test, which is not to be considered an exercise, we need 2 sheets of A4 paper, taped together using adhesive tape. We then turn the sheets over and secure them to the table in order to facilitate the performance of the test. Use a black marker to draw numerous black bars in different directions over the entire surface of the 2 sheets of paper. The center of the 2 sheets must coincide with the center of the patient's body. Once the sheet of paper has been prepared, we give the marker to the patient, who will be required to identify and cross off each bar in this manner. We must take note of any small indicators and elements that may reveal potential cognitive difficulties in exploring the area on the left-hand side. As you can see, I have begun on the right in order to show you one of the characteristic tendencies of left hemiplegic patients. When we have a pen in our hand and a sheet of paper in front of us, this situation is reminiscent of the activity of writing, and we typically move from left to right. This indicator, even if rather weak, reveals the patient's preference to focus their attention on the right-hand side. Another aspect that must be noted is the time that the patient dedicates to the right visual field with respect to the left. This is another indicator to be noted. Another difficulty that's often encountered in more serious cases is that of overlooking a number of bars on the left-hand side. These are just a few of the indicators worth noting, and I recommend filming this test while it's being performed and comparing the video with those of the tests performed several weeks after you have already begun the neurocognitive exercises shown in the video guide, as this will allow you to note any improvements in the defects previously described. These indicators may also be present in the patient's daily behavior. In fact, if the patient has difficulty exploring the food on his or her plate and overlooks the food on the left-hand side, we may notice that after doing the exercises, they begin eating everything, or even in the completeness of their daily shave. Perhaps even in the management of their body, like with patients who show considerable neglect and ignore their left arm entirely without taking it into consideration. In these cases, you will likely notice that they use their right arm to grab onto it. This is not yet a sign of recovery, because even the fact that they grab onto their left hand with their right hand is another indicator of the difficulty that they have managing their left arm, as it is seen as an object to be grasped using the right hand. This same phenomenon can be observed with the lower left limb, which is often positioned away from the body and recoiled with the knee, falling towards the left, and we can see that the patient is gradually able to hold it in an increasingly collected and symmetrical manner.